everyone. I am Dr. Prerana Gupta and I am a consultant psychiatrist at Tirthankar Mahavir Medical College, Moradabad, Uttar Pradesh. So today's talk will be about dementia. And dementia is a disease which affects millions of people worldwide. Most of the people think that dementia is only about forgetfulness. It is not. It is also concerned with the loss of executive function, loss of everyday social functions, confusion, and a lot more other things. So it is just not forgetfulness, but a whole gambit of cognitive symptoms along with forgetfulness. And forgetfulness is just the one major predominant symptom of dementia. So it is very important to recognize dementia in its early stages. It is a little bit different from normal aging because everybody ages and everybody gets a little forgetful sometimes. But dementia is a disease, and this disease is characterized by loss of cognitive functions. So you are unable to carry out all those functions which you previously used to do very easily. For example, managing your bank accounts, or for a housewife, it could be, managing the kitchen and the household and the expenses of the household. But a lady or a person who is afflicted with dementia, he or she is unable to do that. And also there is a loss of social functioning, because of all these symptoms. A person who's afflicted with dementia usually does not prefer going out and meeting other people. And slowly and steadily, this is a progressive disease. Alzheimer's disease is the most common form of dementia, but apart from Alzheimer's, there are also various other causes of dementia. And the second most common cause of dementia after Alzheimer's is multi-infarct dementia, wherein you have a lot of multiple infarcts in your brain, and that leads to a loss of normal communication between the neurons. In Alzheimer's, the pathology is that there is some structural damage to the neurons, and that is why they are unable to communicate effectively with each other, leading to the loss of function. But what we have to remember is that this is a progressive disease. If we are talking about Alzheimer's, which is the most common one, so we cannot stop it, we cannot halt its progress, but definitely we can do treatment, which is going to, give us some more fruitful years in our lives, in the lives of the adults who are afflicted with Alzheimer's dementia. So there are various modes of treatment available in which, preserving the brain structure and function is of the utmost priority. So let us recognize these diseases in our adult and aging population. Let us give them the awareness of how to manage this disease. Let us also refer them to the specialists so that they can get the required help. And also let us promote a healthy lifestyle in our aging population, because what happens is with age, people generally tend to reduce their physical activity. They tend to reduce taking care of themselves. They feel that that now the end of life is approaching, so I might as well just sit at one place and not do anything. Let us not make that a habit amongst them. Let us promote good physical health, because a good physical health is also leads to a good mental health and a good brain health. So let us help our parents, our relatives, or any other people who are aging. Let us make their aging a more healthy one and a more happy one. Thank you.